We are all due for some positive news on the COVID front, wouldn't you say? And tonight, a small glimmer of hope. We are learning more about the lifespan of the highly contagious Delta variant. This chart from the New York Times shows the number of new daily cases has risen less over the past week than at any other point since June. There is no guarantee that the trend will continue, but it could mean caseloads may soon drop. We have seen this happen before in other parts of the world. New cases surging for roughly 2 months before they start to fall. For instance, India reported 81,000 new cases on April 1st. The surge then peaked with about 380,000 new cases in May. And then by the end of June, you can see there it dropped back down to 48,000 cases. And it is not just the Delta variant. The 2-month cycle seemed to have happened with the Alpha variant right here in the U.S. That is the line you see on your screen in blue, where you can see it dip after that peak. Dr. Susan Casey Bloodsdale is with the University of Illinois Hospital and Health Sciences System, and she is joining us tonight. I really want this to be true, that this is a sliver of hope, that we are maybe turning a corner. Doctor, do you believe that Delta has potentially peaked?
I think there's a good sign that we're starting to see some slowing in some areas across the country. We're starting to see a little bit of plateau, that maybe we'll start to see the downward trend again. I don't know if it's necessarily a similar reasons for how it's happened in other countries, but I think that it's just the pattern of the way the infection is spread. We have the cases of the positivity starting, and then the hospitalizations lag that. And then unfortunately, then about 2 weeks later, we'll see the deaths that come from the complications of the infection. So it's sort of, the peak comes after the transmission and after we kind of know what's happening, and then people start using more precautions. We know with this recent starting to plateau, maybe this is related to the CDC's updated recommendations in July that suggested that even those that are vaccinated should be wearing masks. And I think that it increased our safety measures that hopefully prevented further transmission and a higher peak. And that may be why we're starting to see some decline now at this point.
One of the conversations that I keep hearing kind of bubble up to the surface is this idea that we're going to move out of the pandemic phase and into the endemic phase, where COVID will be around with us for years. At what point does that start to happen, and are we there yet?
I think we're not there yet, because right now we're still seeing an increased number of hospitalizations that are putting strain on our healthcare system. And this is not like a routine endemic flu that we would see in a typical season. And so I think we're still seeing a significant amount of transmission and severity of illness. Hopefully, as we have more immunity through vaccination, over time, there will be less severe illness, and then there will be subtle changes in the virus that will cause some disease, but not the severe disease that's leading to hospitalization and deaths that we're unfortunately still seeing for a significant number, even here in the United States.
Do you think we'll get to that point where COVID will be with us for good?
I think it is with us for good, as we're starting to see even, changing variants that are across the globe that we'll ultimately see here in the United States too. So I think it is here with us. The thing that we do know is we know how to manage it different than we did a year and a half ago. We know the things that help to prevent transmission. We have vaccines available to prevent the severe complications. We also know for those that are not as susceptible to the vaccine, those that are compromised, we know that an extra dose of vaccine will help to protect them as well. And we know that masks work, that in the right setting, continued masking is helpful to get through this surge, and masks may be important during times of increased cases. During flu seasons, we know now over the last year, we had really no influenza, and that was because we wore masks through the flu season of the last year. And so I think it's with us to stay. We're learning how to live with it, and we're learning the things that we can do. And eventually we're going to get back to more normal activities, but they're going to have maybe sometimes that we're going to need some extra precautions.
More normal sounds pretty good. Still got a long way to go, though. Dr. Susan Casey Bloodsdale, appreciate you bringing some clarity as we continue through this thing together. Thank you.
Thanks for having me.